Hi, my name is Janet Chesnick, and I'm an LPN and student nurse. I'm currently working on my RN and BSN from Indiana State University. This video is part of a series of 7 videos that I am making for my Community Health Nursing 444 class. I also work as a triage nurse for our pediatric primary care office. So each video will discuss a different topic that I am asked about frequently as a pediatric triage nurse. The population at risk that I'm addressing is pediatric patients and their parents. Before I begin, I do want to emphasize that this video is informational, but in no way should replace consulting with your own pediatrician. One of the more common topics that I'm asked about is congestion. Special note that this is not in regards to the current pandemic. This is actually more of what I was asked about pre-pandemic, but some of the information does still apply. So the learning objectives for this video are newborn nasal congestion, what causes it and how to treat it, nasal congestion in older children and how to treat it, coughs, how to tell if it's an illness or an allergy, and when you should be concerned. There is a pre-video quiz if you're interested in quizzing yourself before watching the rest of the video, as well as a post-video quiz, and there's also a handout attached to this video if you are interested in stopping the video and checking those out before continuing. So newborn congestion is actually very common, and it doesn't necessarily mean that your newborn is sick. Newborns do not have sinuses like adults do, so any amount of mucus, inflammation, anything is going to cause some nasal congestion. If they do have any sort of mucus, it can drain out of their eyes as well as their nose, and it can also go into their ears, which is why infants and younger children are prone to ear infections. Any kind of congestion they have can make your baby sound like a little piggy, which is nothing really to be alarmed about. It just means that they have some congestion. And that congestion is typically not due to allergies. Even if the parents have allergies, seasonal allergies don't typically develop until the child is at least 2 years old. So how can you treat it? They are too young to give cold medicine. So really the only thing you can do is try to keep them as comfortable as possible by suctioning out their nose. There are some nasal saline sprays that you can use, and running a cool mist humidifier near them, especially when they're sleeping. Okay, congestion in older children. Once they get old enough and they're in daycare, they often can catch cold after cold. Since there are thousands of viruses that can cause this, can cause the common cold, it can seem like they just have one continuous cold. Eventually their immune system, especially if they're an otherwise normal, healthy child, will catch up, and as they get older, they will get sick less often. But the big important thing is as they age is to teach them proper hygiene and prevention techniques like hand washing, covering their cough, using Kleenexes to wipe their nose, and things like that. So how to treat it? Do not give cold medications until the children are of appropriate age. Different cold products have different ages. I have attached a link at the end of this video, as well as in the handout, on more information about appropriate ages for giving cold medications to children. You can still use the cool mist humidifier. You can use a variety of nasal sprays as they get older, not just the saline, but there's also some steroid nasal sprays that kind of help open up the nose nasal passages. Make sure they're drinking plenty of fluids and they have good nutrition so their body can fight the illness. And then, of course, they are practicing good hygiene. Coughs are a big one. Nasal congestion, while annoying, is not as big of a concern because while your nose is congested, if you need to, you can always breathe in and out of your mouth. But once you start coughing and that congestion gets down into the lungs, that's when I start getting a lot of questions from parents. Coughs can be caused for a variety of reasons. if they have a foreign object in their windpipe, or also by illness. So, if they have some nasal congestion, that nasal passage is connected to their throat, so that congestion can drip down the throat and cause a cough. Wet coughs are when the child sounds like they're really trying to cough something up, and they may or may not be successful in coughing it up. Dry coughs sound more like a reflex with nothing coming up. There are coughs that are more distinctive. One cough in particular that worries parents is when they get that seal bark cough, and that is a trademark of croup, and there's a lot of different types of croup. It's a very common viral infection among children that all we can really do is kind of keep them as comfortable and let it run its course, but that tight seal bark cough can be very concerning to parents. Once a child hits 1 year of age, they can have honey to try to soothe some dry coughs, but outside of that, if you're using any sort of cough syrups, you need to check the ages and the ingredients to make sure that it's appropriate for the age of your child. So, is it an illness or is it an allergy? This one can be a tough one. Allergies typically involve clear nasal drainage. They'll usually have stuff like itchy and watery eyes, other types of symptoms as well. Illnesses can also cause clear nasal drainage, but you might also see yellow or green nasal drainage. So if you see yellow or green nasal drainage, it's not an allergy. Allergies can last for months, or they can be year-round, depending on what the allergen is that's causing them to have that reaction. So if your child has allergy-type symptoms quite often, it might be worth talking to your doctor to see about testing to find out what it is that's causing these allergies so that you can avoid them if possible. Illnesses like colds usually last 1 to 2 weeks, but it is possible to get back-to-back colds. If your child does have an allergy, it's going to improve with an allergy medication like Claritin or Zyrtec or Allegra. Illnesses are not going to improve if you use those medications. So when should you be concerned? If your child is having trouble breathing, especially due to coughing a lot, and they're having trouble catching their breath because they're coughing so much, they're getting discolored, things like that, definitely need to reach out to your pediatrician. If you hear wheezing coming from their chest, that is a cause for concern, especially if they've never wheezed before. If it looks like their chest is really sucking in and out with their breaths because they're working so hard. If they're unable to do normal activities due to their shortness of breath. And any kind of symptoms that are just causing you concern, always just talk to your pediatrician, even if it's not one of the ones listed here. Definitely touch base and check with your pediatrician to see what further follow-up might be needed. This is a list of references, and I'll have this and more on the handout. These references I used for this video, as well as I have referred parents to them when they've had questions about medications and also about different types of coughs. So if you have more concerns about your child's health, definitely check with your pediatrician. As a new parent, you do become accustomed to what's kind of normal for your child. So some children, like the ones that have asthma, parents become very used to what's normal and not normal for them. So if you see something new concerning, check with your doctor. There is a handout and a post-video quiz attached to this video if you're interested in checking those out. So thanks for watching.